Hello YouTubers. Right, update on Andy again. Right, I went to see him yesterday. Oh, he played up. He played up like he usually does. You'd never believe it. Yeah, yeah, he played up. Oh, but we managed to get things done. Yeah, he has a wound on his back, obviously, and I don't know how they've done it, but they're packing it. But the thing is, it was leaking. And so there was this big pool of whatever it was on the bed sheet. So managed to get that changed, despite the fact that he put up a bloody fight like he usually does, and straighten him up on the bed, because he's got one of these airflow mattresses on the bed. And oh, I think they're trying to get the transition over right, because I noticed yesterday that his pain relief, the pain the pain team came up, and because he's on one of these morphine where he doses himself, yeah, because it gives measured doses, yeah, he can't overdose on it. But what they want to do is to try and take him off that and put him on pills and other medication, yeah, the transition. And I had a phone call this morning from the stoma nurse, and I did mention it before that and with me being a carer, I'm having to learn things, yeah, and this is something that I'll need to be learnt how to do to change his stoma bag and the likes, yeah. So be next week sometime when I'll be going up early and they'll be showing me, yeah. Yeah, they'll be showing me. So but Andy's always phoning me up and wanting me to go in early. Well, I did yesterday. It wasn't that early, but it was early for me. It was just after 1 o'clock, and their visiting times is 2. So I went away early because I needed to do some shopping, and yeah, like I say, Andy, he plays up. He didn't eat anything yesterday. He's supposed to eat something. They're trying to get him to eat, right? The consultant or the person that's in charge, yeah, he came to see Andy, and they have to get him to eat. He needs to take some food in, yeah. Otherwise he'll never get better, because he needs to take that nourishment in. There's nothing now for no excuse now, yeah. And he keeps getting he calls them spasms, but they're actually they are stomach cramps. It's because of the way your digestive system itself works. It's like, because you know when you take food in, you swallow it and it goes down, your digestive system sort of, it's a bit like a snake, somebody's saying, that, yeah, it's pushing your food down. Your muscles are pushing the food down through your body. And that's what they're on about, and it's normal. Apparently it's normal to do that. So but by the sounds of it, it sounds like I know Andy's so desperate to come out of the hospital, but they need to get things in place and make sure that he's doing things he should be doing. And it sounds like he might be coming out next week. That's what it sounds like. So I'll have to keep you updated on that. Yeah. Because I know Andy's like, oh, I want to discharge myself. The thing is that don't hesitate to get this bloody discharge bloody paper. They don't hesitate at all. Now I'm thinking to myself, do you know, there's a person there, right, he's ill. And you want to chuck him out on the street just like that. Oh, it annoys me sometimes. It does. Yeah, it does. I think I was in the room one time and Andy played up and wanted to be discharged, and one of the healthcare assistants said, oh, we'll be able to discharge, you'll be able to be discharged, we're not stopping you. And I chirped up. I said, no, he can't be discharged. I mean, he's not well. And that was a couple of weeks ago. Yeah. Yeah, they're too quick on that. That's what annoys me, they're too quick. Yeah, they're too quick on that. And another thing, while I'm getting on to complaining, when Andy was moved onto the ward, yeah, oh, they were coming to see him every hour, you know, his blood pressure, doing this, that and the other, you know, every hour. The following day, which was yesterday, I was thinking to myself, do you know, if I wasn't there with him in that room, yeah, and if he died, there would be hours before they find him, because even on that ward, and I'm thinking that's the bloody ward, a surgical ward where you have people that's just had surgery, yeah, and anybody could die. I mean, you wouldn't even have time to press a button or anything, you know. Because when a person dies, you've got this window where you have to resuscitate them quickly. And I'm thinking, well, if Andy died, there would be hours before they find him. Yeah. Nobody comes to see him, you know. Nobody, like I say, when he first got admitted onto that ward, oh, aye, everybody, every hour he was getting checked over and the likes, you know. Oops. And yeah, now that that day is over, it bugs me, because when he was on that ward before, because he's up the end now where the 6-bedders are, and I would notice everybody, every nurse and everybody was down there, you know, and not coming up to the side rooms. Yeah, I noticed things like that, and I know that they check on Facebook. So yes, I notice things. I'm not stupid. Some people think I'm stupid, but I'm not stupid. But I do notice things. Now that he's down near the 6-bedders, yeah, I don't notice many people up that end, and I'm thinking, well, because I noticed them up the other end, where the singles are, the side rooms up the other end. Yeah, I noticed a lot of activity up there. Yeah, like I said, people think I'm fucking stupid. And I'm sure they're avoiding where Andy is. There was one time, and I'm sure it was on that ward, yeah. Andy was in one of the 6-bedders, yeah. Obviously, they didn't like being there. He was in pain. He annoyed the patients that were already there. But there was a patient, a couple of beds down from Andy, and the guy, he actually had a stroke in the room. He was sat on the chair next to the bed, and if it wasn't for one of the other patients noticing, they pressed the button, oh, they were there straight away, you know. Yeah, the guy had a stroke. But if you're in a side room on your own, you could die, nobody would know, nobody would find it for hours. Because you wouldn't have nobody watching over you to press the button. And I've noticed even with that, pressing the button, you know, to call, and I found myself looking at the clock to see how long it takes somebody to come into the room just to answer the button. Yeah. And then when Andy needs assistance in things, I mean, they're not exactly quick to do it either. Oh, it does. Things annoy me. Things actually bug me. And they bug me. Yeah. Like I say, people do watch this. Watch Andy's vlogs. So yes, I'm not happy. So I'll just kick that over there. It's a bag. I'm lucky because when Andy puts anything, if he does put anything up on YouTube, yeah, he usually does it straight to his phone. And what he forgets is he can't mention anybody's names. And I don't mention anybody's names, obviously. Because, oh, I don't know, it's some sort of clause or, you know. But, yeah, his channel does get watched. Yeah. And I don't care. Right. All that's said and done, that's my rant over. Yeah. But one word is, I like any ward, even if it's got side rooms, even if somebody, right, would just, off their own bat, like I keep saying in the last video, just go into the rooms and just check the patients if they want anything. You know, just to check them. Because there'll be one day that somebody will walk in, that person be dead. And then what they do, right, was they'll try denying everything. Oh yeah. Yeah, they'll try denying everything. Oh well, we got there in time. We got there, tried to get there in time, and yeah, you hear all that. I've heard all that before. But right, I'm gonna go. Right, and speak soon. And toodaloo for now.